Um, so during my prac placement, with each of my clients' interventions, I did really try to apply each of the four pillars of evidence-based practice, or at least two or three of them. So for each of my interventions, I did actually use evidence behind most of the things I was doing. For the pain management, for the client that I was working on with osteoarthritis, there's a lot of research and a lot of evidence behind, exercises and wax baths and all that kind of strengthening things, which sort of help the OA strengthen the muscles, hopefully reduce or prevent pain. I also looked at the client's needs when working on this intervention. She was in a lot of pain. We couldn't get her to leave her room because she also had another issue with her hip. So this was something that we could actually do that would benefit her. She expressed the need to have hand therapy done because she was missing out because of her hip injury. So we were looking at the client's needs and values as well, and reducing the pain also increases quality of life. And it's something that she did report as well. So after a while, she did report that she was feeling a lot better, and the hand therapy, that was part of her reasoning behind feeling a little bit better because she had reduced pain. And there's also the clinical experience that we got when we were doing the hands unit in second year. There was, a lot of discussion around osteoarthritis and the benefits of doing exercises and doing the wax baths and all that kind of stuff. It is very PT based exercise plans, so to make it a bit more occupational therapy based, we were working towards the goal of getting her back to knitting, something that she really enjoyed, and it's something she did a lot of before her osteoarthritis. So yeah, it was quite exciting to do. We saw a bit of a difference with her even in the short time we were doing it. We worked with a lot of other professionals while we were doing it too, and it became really good. That was probably we used most of the four pillars of evidence-based practice when that came with one. We had clinical experience, limited, but we still had clinical experience behind what we were doing. We had research to back up what we were doing could benefit. We had clients' needs at the center of our approach, and we looked at the ethics of it. It was probably one of the only interventions that we could do with her at the time because of her current situation with a few other problems that she had, which meant she couldn't leave her room. So this was something that we could just do in her chair in her room. So it was a really good one. With all of our clients, we value the client's needs, and everything we did, obviously, we asked them about, and we asked if they would actually want to participate in that. So that we used that evidence-based practice for all of our clients, for all of our interventions. We used evidence when working with, we did a memory scrapbook, and there is evidence behind the use of doing memory recall and helping people with dementia, and she had vascular dementia. So yeah, that was we did try and apply most of our all the pillars. I guess one thing that I have learnt though is that I do need to solidify my knowledge, especially when it comes to research and collecting research, so that my evidence and my justification behind my intervention is stronger. So I can actually, explain it better why I'm doing what I'm doing, which is something I'm sure we all need to do, and have good solid justification behind it, because there's so many, you can get your client's needs into consideration pretty easily. Once you start getting experience, you can use your clinical experience very easily. Ethics is something that we do anyway, and we try to do, but research and actually having a knowledge and something that says yes, this can work or this does work, is something that I do need to work on. I do feel like, though, I did pretty well at making sure that my clients' needs were considered when picking my intervention. Um, I'm actually quite proud of some of the stuff that I've done on my prac placements. The clients have reported back that they've enjoyed their time with us. All of my clients have been lovely, and I think they do enjoy us coming around. They enjoy what we're doing with them. And I think that's because we can, this was a collaborative approach. They helped us decide on the intervention. It wasn't something we just set for them because we wanted to do it. We did it because we took into consideration the needs of the client, something that they had said to us. It was something that we'd discussed during our initial interviewing and all of that goal setting. So yeah, I really think that our ethical and client needs considerations, we did that very well for all of our interventions. My clinical experience, I tried to. I mean, it is a little bit limited. I'm still a student. There's only so much I have done. Um, but yeah, so my evidence, I know that there's research out there for this and that, and we've been told in class that yes, this works well, but I do need to research more, and that's something that I did outline in my action plan dot points, to research better and have a more solid justification using that pillar of evidence.